I'm going to tell you what we have planned for today very quickly, and then we're going to go into the substance of the meeting. Thank you all for coming. We have 250 people in the meeting right now, and I hear we have almost twice that many registered. So we're going to have 3 presentations, not very long. Dean Hubbard, our executive director, is going to provide us with the most up-to-date information on the Aetna struggle. And he's going to provide for us where we are in the political context and what our strategies have been to date. Following Dean will be Nancy Romer from our executive committee, and she's going to tell you a little bit about a direct action that we are planning in collaboration with other organizations who have the same goals as us, which is to keep our Medicare, to keep our senior care free, to keep our welfare fund benefits. And that will be Nancy, followed by Debbie Bell, our former executive director and a major health policy expert, is going to talk to us about some of the nitty-gritties in the MA plan, in the Aetna MA plan, how you can get more information about it. She's going to address and answer what we hope will be broad questions that have relevancy to a bunch of people, a wider group of people on this Zoom, not personal questions about just me. For those questions, we'll direct you elsewhere. We also, I think, have Donna in the house. Is Donna Costa in the house from the Welfare Fund as a resource? And I think with that, we should start. Dean?
Thanks, Anne. And thanks for showing that very moving video of what people are doing in France. That was really incredible and very moving. Forgive me if I repeat stuff that folks already know, but I want to make sure everybody has the basic information. The MLC unions voted on March 9th on the proposed contract between the city and Aetna. The vote was held despite the fact that we were not shown the contract before the vote took place. PSC voted no. We succeeded in getting 24 other unions to join us in voting no, but ultimately we did not prevail in that vote. The day after the meeting, OLR posted the contract on its website. Debbie Bell and Barbara Caress, who will both know quite a bit about healthcare policy, immediately started coming through it. And they found some language, which I then reviewed and also had our outside counsel review. And we confirmed that the contract contains an option called option C. And I'm going to try to just post a little summary of it here that Nancy Romer suggested I share with you, which I think is good. Can everybody see that?
Mm-hmm.
Hang on one second. What basically we found is that the contract contains an option that's called option C, which, if the city chooses it, would allow retirees to keep their traditional Medicare plus premium-free Medicare supplemental plan. That plan would cost the city $20 per retiree per month. But Barbara Caress, who, as I mentioned, is a health policy expert, has crunched the numbers, and she has estimated that this option would still save the city about $350 million more per year than they are currently spending on retiree health care. And I am now going to try to post a link to our costing so you can see that. You know what, instead of posting it, I'm just going to put it in the chat. There's the link to the costing. So option A is the option that the mayor has said he is choosing. That is the option that says every retiree would be forced into Medicare Advantage as their only city paid option. And the only opt-out would be into the HIP VIP, which is a Medicare, so-called Medicare Advantage HMO. Option B would allow retirees to pay for a Medicare supplemental plan, but that option is not legal, according to the decision by Judge Frank, which was upheld on appeal. We were successful in opposing the mayor's effort to get the council to amend the administrative code because the way that would have allowed retirees to pay for their Medicare supplemental plan was by taking away the floor that currently exists in the law under the city's contribution to healthcare, not only for retired workers, but for in-service workers. So right now, the law requires the city to contribute up to the cost of a HIP HMO, which is currently over $700 a month. If that change had passed, the city would have had no obligation to contribute any amount at all to anybody's healthcare. And the PSC did not support that, and we succeeded in defeating that. So the mayor is the final decision maker on whether the city goes for option A, option B, or option C. And he has to let Aetna know his decision by April 1. So right now, we are completely and totally focused on creating enough pressure to force the mayor to choose option C, which would preserve premium-free Medicare supplemental benefit along with traditional Medicare before April 1. So if folks on this Zoom have not yet sent an email to the mayor and called him, we would ask that you please do that today and ask every city retiree or retiree supporter that you know to do so today. I'm going to put in the chat the link for you to send that email and make that call. Hang on a second.
I got it, Dean.
Tina got it? Okay, great. Thank you. There also will be a very important action on Friday to pressure the mayor to do the right thing. Nancy, I think, is going to follow me up and let you know about the particulars about that. We are also asking council members this week to sign a letter to Mayor Adams asking him to pick option C. So that is our total focus right now. It's on the days between now and April 1st. We have other ideas about what we could do after April 1st, but there's another retiree meeting next week. And for right now, really our total focus is on creating enough pressure between now and Friday to force the mayor to choose the option that would allow people to keep their traditional Medicare plus their city paid Medicare supplemental plan. And that's it from me for now, and I'll be happy to answer questions when we get to that.
Okay, thank you, Dean. Nancy's going to tell you about something very exciting.
Okay, thank you. So I just want to do a very quick and abbreviated thank you to our President James Davis, who's the only union president in the entire city who has been able and willing to step up and oppose the destruction of public Medicare. And that's a huge step forward. Dean, Debbie Bell, Barbara Carras, the retiree chapter, really big thank yous. We're planning a very exciting demonstration. The mayor is supposed to be making a decision on which option he will choose on April 1st. This action is the day before March 31st, Friday, this Friday at noon, and we will be meeting at City Hall at noon. It's not clear whether we'll be on the east side or the west side. We'll let you know. But the important thing is that you put in your calendar right now, Friday, March 31st, noon, City Hall. We are protesting the Aetna contract. We are working with the cross-union retirees organizing committee and the DC 37 retirees. There will be many others who will be joining us. Our message is we want Medicare, not profit care. We want option C because it preserves Medicare, if even partially. So those who have option C, who choose to get out of the Aetna contract and be paid by the city, will be maintaining our public Medicare. Okay, so all hands on deck. We want you to bring friends and colleagues. We'll send you some messages about the outreach, but it's really important that every one of us takes responsibility for pushing it out to everyone we know who might come, including in-service members of our union and other unions who will see as soon as this goes through, their healthcare will be next on the chopping block or on the snipping block, if not chopping. So bring friends and colleagues. We want you to bring props. If you happen to have crutches, if you have a walker, if you want to bind yourself in some kind of bandages, cool. If you don't want to, that's cool too. If you have any PSC hats or anything else to bring, wear them proudly. Bring signs if you wish. If you don't wish to bring them, we'll have some signs for you. But right now, what's really important is for you to go to the chat and put your name, your email, and your phone number in the chat. I repeat, go to the chat, put in your name, your email, and your phone number, and indicate one of two things. If you can't come, don't tell us, okay? Tell us, yes, I can attend, and yes, I will call other members. I will be on a phone bank. Just say, I will call, okay? To make it short. We will be organizing phone banking, that is calling out to our members on Wednesday and Thursday to make sure people get out. And we really need a big team for that. So just want to thank everybody who's in this effort. It's going to be a very exciting demonstration. And it's really up to the minute because the mayor's got to make a decision on April 1st as to which option he's going to choose. Okay, thank you so much.
Nancy, can you repeat that we need not just names, but email addresses and phone numbers?
Yes, email addresses and phone numbers so we can contact you easily. And by the way, the PSD staff, particularly Ava Farkas, fantastic. Thank you.
Yes, Ava is our A1 organizer and has done a terrific job. And along with people from the EC who are putting this together in a very, very, very short time frame. So please put your name in the chat, your email, your phone number. If you will attend, bring somebody and help with phone banking. This is it, people. I mean, this is it. And this is we have not been out on the streets. We've been out on the streets as individuals with other organizations. It's time for the PSC to be out on the street. And now we're going to hear from Debbie Bell with some of the nuts and bolts on the Aetna plan. And then we will start to take questions and comments. So Debbie.
So I'm going to be as brief as I can, but this is going to take a few minutes to get through what I want to say to you today. Everyone, retirees and dependents age 65 and older are going to be automatically enrolled in the Aetna MA plan come September 1st, except those who are enrolled in currently enrolled in HIP VIP. There will be no more senior care. There will be no more supplemental plan. Dependents of retirees who are under 65, who currently are in an active employee health plan other than GHI, will be shifted over to GHI, and then ultimately to the new plan that's going to take effect for actives on January 1st of 24. The Office of Labor Relations sent a letter dated March 10th, the day after the MLC vote, to all New York City retirees. If you have not received it, neither have I. So, you know, they're arriving very spottily. It's a letter explaining what's happening, and a letter that has a comparison chart between the Aetna MA plan and Senior Care. Aetna itself will be sending out materials over the next month. I'm not sure if it's one package or two. One thing I want to remind everyone of, if your address has changed, please notify the Office of Labor Relations, because otherwise you won't receive any of this material. And I think Ava can post in the chat the email link for the change of address form. So, first of all, aside from the fight that we're engaged in, the issues around deciding your own personal coverage, you've got some time, and I encourage you to take that time. First of all, educate yourselves about this Aetna MA plan. It is better than the plan we looked at a year and a half ago. It's still Medicare Advantage, but it's better. So there are materials on the Office of Labor Relations Employee Benefits Program website, including a description of the rules of the plan and the what is covered, the way Medicare sends out every year, in the evidence of coverage. There are materials on the Aetna website, including the ability to determine if your provider is in the Aetna network. It works much, much better than the Alliance system did. And it's not too complicated to figure out how to get at it. There is also a dedicated call center for New York City retirees at Aetna. And hopefully, I had asked Ava to maybe share something. You don't have to look at me. You can share the materials so you can copy them. There is also on the Aetna website a schedule of Aetna information sessions. I encourage you. You may hate Aetna, you may hate Medicare Advantage, but I encourage you to attend an information session and ask them your personal questions, because they've got to know what our members are concerned about. I'm assuming the union and the welfare fund will also schedule some 1 or 2 information sessions over the next month. One thing to keep in mind, you will continue to be covered by the PSC CUNY Welfare Fund if you are automatically enrolled in Aetna Medicare Advantage. Therefore, when Aetna talks about their prescription drug plan, that does not apply to you. Your prescription drugs continue to be covered by the welfare fund. You see in the chat, they don't really answer questions. Well, that's a problem, but you know, we've just got to keep at them. So as you know, it's important at this time, retirees don't really have a choice other than the one Medicare Advantage HMO, which is HIP VIP. What are the alternatives? And that's sort of, I know what a lot of people have questions about. First of all, you never, ever lose the right to be enrolled in traditional Medicare. But remember that Medicare only pays 80% of the Medicare approved fee for your Medicare, for your health services, which is why the establishment of a supplemental plan is so important if you're going to stay in traditional Medicare. That's what Senior Care now pays, the additional 20%. So I want to talk for a minute about those who are considering opting out of Medicare Advantage. It is important to educate yourself about the alternatives. There are good reasons to be critical of Medicare Advantage, but it is true that for many people, it is a workable form of coverage, particularly for those who are still active and relatively healthy. It is not a death sentence, and I say this based on querying people currently covered under Medicare Advantage plans around the city. For information about what are called Medigap plans, which are the supplemental plans to traditional Medicare, you should contact the Medicare Rights Center. I asked Ava to post in the chat their website and their phone number. They operate nationally. Medigap plans, which are the supplement to traditional Medicare, are regulated by each state. So questions such as price, such as pre-existing conditions, etc., those things can vary by state. And the Medicare Rights Center makes it its business to know how different states operate. If you want to, you can just Google Medigap in North Dakota, and you'll get some sites that give you if you're in North Dakota, give you some information about North Dakota. The city and Aetna have set a period for opting out. That period runs from May 1st until June 30th. I encourage you not to rush to opt out until you really have, I'm not arguing for Medicare Advantage, but I really want everyone to have studied what's available to them and evaluate your own particular needs and what is offered. I also want to point to, in the Aetna materials, there is, because I don't have them at hand, there is information of how to opt out. There will be a phone number, and there will also be an online way to opt out. You opt out to Aetna this time around, not to the city, to Aetna. Now, what are the implications of opting out? As of now, what the city is telling us, is number one, that they will not reimburse Medicare Part B or IRMA if you are not covered by a city health plan. That means, and also you will no longer be eligible for welfare fund benefits. As people are noting in the chat, we are fighting back on all of this, and the PSC is taking steps on both counts to try to ensure that there are no implications of opting out, but at the moment there are. There are also questions about providers, services, and treatments. These are questions that we at the union and even at the welfare fund are not necessarily able to answer, except to repeat to you what's in the written rules that Aetna uses, which is why I encourage you to just keep peppering the Aetna representatives with your questions. And if you're not satisfied with their non-answers, keep it going. It's another form of fighting back, to be truthful. If you have a scheduled medical procedure, if you have ongoing medical treatment, if you use medical equipment on a regular basis, such as an insulin pump or an oxygen pump or other such things, you should pay attention to the materials that Aetna sends, because there is a continuity of care form, which they say you should fill out and submit to describe what is going on, so they can have their staff contact you to ensure continuity of care. I encourage you, whether you were thinking about opting out or not, submit the form. Find out how they're going to deal with your ongoing issues if you, in fact, you decide to stay. As to Aetna's provider network, it is in fact broader than the Alliance network was. It is national. again, you can use their website to determine if your provider is covered. We heard testimony last week, somebody saying the website says my provider is covered. My provider says he's not in the network. Remember, like last time, providers don't necessarily know about this new plan. They know about Aetna Medicare Advantage as an individual buy-in plan, and many of them don't participate in that. So you have to use the website that they give you to figure out if your provider is, in fact, if Aetna says they're in the network. And if that is the case, providers in the network bill Aetna directly for services and are paid directly by Aetna. Providers who accept Medicare but are not in the network will, according to Aetna, be paid for their services at the Medicare rate. Now, again, this is reading not reading between the lines, reading the fine print. Aetna recommends that patients of providers who are not in their network but do accept Medicare ask those providers to seek a pre-visit coverage decision to ensure that services are covered and medically necessary. Otherwise, in theory, Aetna could deny coverage even though the provider accepts Medicare. So, you know, as we've said about Medicare Advantage generally, they define their boundaries and they do create limits. Aetna will not pay for services from providers who do not accept Medicare. But I assume any of you who is seeing a provider who doesn't accept Medicare is paying directly for that already. Aetna does pay for urgent and emergency care, including internationally, although internationally you might have to pay up front and then seek reimbursement. Aetna says it will cover medically necessary services for retirees in assisted living and in memory care facilities. They will work very hard to ensure that happens. You know, I don't have an answer for how someone who is in a memory care facility and therefore doesn't even know their health plan has changed is going to inform their provider that their health plan has changed. But they say they will pay for the medically necessary care. We'll see what happens down the road. Another area of concern has been prior authorizations. Aetna has agreed at a price to the city, I mean, the city is literally paying for this, not to require prior authorizations for a large number of services. A list, I believe a list should be in the materials that are sent out. They are primarily high-tech radiology and scans, diagnostic cardiology, and physical and occupational therapy. Those reduced number of prior authorizations will be in effect for 5 years, although there will be ongoing reviews between the city and Aetna to sort of see how it's going, and as new procedures are instituted, whether to require prior authorizations will be considered. Again, prior authorizations, according to Aetna, are not required for urgent and emergency services. This is in fact federal law. They can't require them. Denials of care can be appealed. There are 2 levels of internal Aetna appeal, and then at the final level, an external reviewer assigned by Medicare is the final reviewer. Don't be shy about appealing denials of care and working with your doctor on those appeals. The final area I want to touch on is open enrollment periods. The city has said it will provide an open enrollment period for retirees annually. In November, to go into a different arrangement the following January. So say November of 23 for a different arrangement in January of 24. Retirees who opt out now and therefore don't go into Aetna Medicare Advantage in September 1 can opt back in November to be effective January 1 of 24. Retirees who go into Aetna Medicare Advantage September 1st can, during the open enrollment period, opt out back to traditional Medicare and buy a Medigap plan. There are layers of stuff that go along with that, which I won't take time on now, but the main thing to know is it is possible to enroll, re-enroll, and remember, you never lose your right to traditional Medicare. We will continue, the staff and the Welfare Fund will continue to seek answers to questions. I encourage you, if you have individual issues, to take them up first with Aetna, perhaps take them up also with the Medicare Rights Center, particularly about alternatives, and collect as much information as you can that's relevant to your healthcare situation before you make a final decision. And of course, I encourage all of us to continue this fight to maintain traditional Medicare and a supplemental plan at no cost to retirees in the city of New York. Thanks, Anne.
Thank you, Debbie. That is a lot to take in, but you certainly, I think, explained it as thoroughly and as clearly as we can. And we will need to repeat these things and hear them again and again and see them in writing. And this is not the first time that we are going to be talking about these things. And so I'm going to open for questions. If you raise your Zoom hand, I will call on people in order. Now we have close to 350 people on this Zoom right now. So I'm going to ask, with your indulgence, that people keep their questions to 1 minute. 1 minute.
And this is Donna Costa from the.
Yes, Donna.
Hi. I was going through some of the questions that were popping up, and I'm just going to take 2 of them that I think are going to be pretty common questions and maybe answer them up front. Would that be okay?
Yes, I think I pretty much finished my previous sentence or thought. Thank you, Donna. Go right ahead. Donna Costa is the director of our welfare fund.
Thank you. I just noticed, I just want to leverage off of something that Debbie had said about the prescription drug coverage, because there seems to be a little bit of confusion. I think the confusion is that the welfare fund's prescription drug coverage is also through CVS, which is an Aetna company, and that the Aetna Medicare Advantage prescription drug plan that's a buy-up is also through Aetna and a SilverScript plan. They're entirely 2 different plans. The welfare funds plan is covered for you at no cost. This new plan that they're offering is for welfare funds that either do not have a Medicare Part D program, or they have a plan that doesn't cover all of their specialty drugs. If anybody, you cannot buy both. I think the one is going to be $100 and some odd per person per month. If you by accident do opt into that program, you will be automatically kicked out of the welfare funds, because that's what CMS will see. You cannot be enrolled in 2 different Medicare Part D prescription plans. So I wanted to make a point of that. The second point is that a lot of you have been asking about your John Hancock long-term care programs and your catastrophic legacy plan. When I say legacy, it's not the NYC plan that came out a few years ago. It's the 10 million. Some of you know it as the $10 million plan. Some of you know it as the Waller's catastrophic plan. It's currently handled by US Life. Both of those plans are not administered through the welfare fund. And John Hancock, I believe, is the direct pay. Members have to actually have a direct pay option for that. And as far as the legacy, I believe that there is a payroll deduction through your retiree pension checks, and some of you are on direct bill. Those are not affected if you are to opt out. Those are, I believe those are the only two that would not be affected because they're not specifically welfare fund administered or paid for. Thank you, Anne. I think those are the two topics I thought might come up most frequently.
Thank you, thank you. And anything you see in the chat, Donna, or you think about, just let us know. Okay, we're going to try to keep the questions to 1 minute and ask a question and try to make it broad enough so it will be of interest to many people on this 350-person Zoom meeting. I see Valerie Krishna first. I don't see you, but I see your name. Valerie. Valerie Krishna? Okay, maybe Valerie.
Hello.
left. Valerie? All right, I'm going to call on Cheryl Bluestone. Cheryl. Can't hear you, Cheryl. Do we unmute? Do we have?
got it.
So,
Can't
All
hear
right.
you.
I think there's a delay when I'm trying to unmute people. It's just like slightly delayed. I don't know why. I'm gonna try again.
Don't worry, time hasn't started yet.
Carol,
Hello? Can you hear me
yes.
now?
Yes.
Okay. I came in late, so I may have missed this, and you've been very clear. I was planning to opt out, but we would have no dental coverage. All of our coverage through the welfare fund that was that was negotiated through the years for us, we will lose that. Is there any hope that we can get our welfare fund benefits? Because that's one of the things that's stopping me from opting into and continuing Medicare. I don't know if anybody else is concerned, but the dental plan is actually quite good compared to having no dental coverage. And I'm keeping it to a minute, but the prescription eyeglasses probably are equally bad. And the hearing, we have much better hearing benefits than Aetna. Is there
Okay.
any hope at all? Can the union do anything? Can anybody do anything?
that's a
Yeah.
concern, and it's been noted by all of us. And actually, it's something that's being worked on. Dean, I don't know if you want to add anything to that.
Yes. We've reached out to CUNY. There is a provision in our collective bargaining agreement that says that for people to be eligible for the welfare fund, they need to be participants in a city-sponsored health insurance program. So we've reached out to CUNY about changing that. We don't know yet what their response is going to be, but we are working on that. And then as Donna is aware, there's also language in the welfare fund trust indenture that's very similar that we also need to work on changing. So we can't give you a definitive answer on that, but just to let you know that we are working on trying to change that. But as Debbie mentioned, if it was to happen today, folks who opted out, that is folks who chose to keep their traditional Medicare and go on the market and pay for supplemental Medicare would not be in a city-sponsored health insurance program. And they would not be eligible for welfare fund benefits. That's the reason that we are pushing so hard between now and Friday for the mayor to choose option C, because that would preserve people's right to keep their traditional Medicare and to have city-paid supplemental Medicare plan. So again, that's our total focus between now and Friday, is to try to force the mayor to do that. If he doesn't do that, then as things stand now, people who chose to keep their traditional Medicare and pay for a supplemental plan would be outside the city-sponsored health insurance program and would therefore not be eligible for welfare fund benefits. And again, we are in contact with CUNY, and the welfare fund is looking at changing the language of their trust indenture but we're just at the very beginning of that process.
Okay, Lisa Flanswright. We have to unmute Lisa.
Okay, can you hear me?
Yes.
Okay, my name is Lisa Flangeis. I am TIAA retirement and contract owner, along with roughly 2,000 other 2,000 TI retirees. I am exhorting the PSC leadership, including Executive Director Hubbard and President Davis, to negotiate with the CUNY Board of Trustees in regards to the release of $10,000 to $40,000 per TIA contract owner that have been encumbered for healthcare premium increases in the highly likely event that 3,000 and more CUNY retirees are in grave danger of being dumped into the garbage disposal of Medicare Advantage by September 1st, 2022. This is Armageddon time, make no mistake. I will never choose Advantage because my out-of-network doctors will not accept payment from Aetna, nor will they be cattle prodded into a nightmarish slaughterhouse of Aetna's Kafkaesque guidelines and policies regarding out-of-network providers. I will be liable for approximately $2,000 a month.
Your time is up, Lisa.
$4,000
Would you
a
please
year
end?
in out-of-pocket expenses for my treatments. I exhort you to approach the CUNY Board of Trustees regarding this hell that all CUNY retirees and new retirees will have been thrown into by December 1st. I have faith in your compassionate leadership to demonstrate to the board.
Thank you very much, Lisa, and thank you for your activism and your continued talking out about this. The question was TIAA, I think, was the original question. Does Debbie or any of you have anything to say about the TIAA funds? I know that has come up before. Do we have an answer?
Right. So, and Debbie actually knows a lot more about this than I do, but this did come up on the first round of Medicare Advantage. And what CUNY and TIAA do is they create an annuity that is at least $10,000, and then they pay whatever premium the retiree is responsible for out of that annuity. So, you know, I think there's a minimum 2 issues that we have to deal with CUNY and TIAA around. One is for folks who end up in Aetna Medicare Advantage who aren't paying a premium, we want to make sure that, you know, folks don't have to have an annuity created to pay a premium that they're not paying. And then for folks who are, you know, who are choosing to keep their traditional Medicare and having to pay for supplemental Medicare, we want to make sure that that annuity is no larger than it has to be in order to pay that supplemental Medicare. And Debbie may want to follow up.
I want to clarify one point about TIAA. The annuity is, for the purposes of eligibility for city health insurance, your pension. Therefore, will not be the union's position that we get rid of the annuity altogether. There are, however, as Lisa pointed out, different retirees have annuitized different amounts, and those amounts may or may not be necessary. It will be necessary to continue to have an annuity. And that's the discussion that, as Dean pointed to, must be held with CUNY and TIAA. The amount necessary may depend if, in the end, there's the possibility of purchasing supplemental coverage with traditional Medicare. So it's the territory on which we are operating at the moment is not crystal clear. On the other hand, I just want to be clear to TIA retirees. The union cannot take the position of eliminating the annuity altogether, because that would have the effect of eliminating your eligibility for health benefits, because that is your pension. So otherwise, Dean said, we've gone down this road a little bit before. One thing I would point out, however, is that with senior care disappearing, retirees will no longer have an obligation to pay for the 365-day rider. So whatever payments you are receiving from your TIA annuity, they will go up somewhat. It may only be by a couple dollars a month, but they will go up because starting 9/1, that rider will not be being paid.
Thank you, Debbie. Rudy Ann Lenang, hi.
Hi, how are you? Yeah,
Oh,
I'm,
yeah.
I'm totally confused, frankly. I'm not as young as I used to be and trying to follow all this stuff. But anyway, can I just, if I opt out and get the supplemental, is it true I would be outside the welfare program? I would not get the drugs. I would not get dental. Oh, I would not get the hearing, those benefits. Is that correct?
That's correct. And you would also not get your Medicare Part B reimbursement or your IRMA reimbursement.
Okay. All right. That was one. I wanted to clarify that. All right. Then the other thing is this continuity of care form. Is that only for equipment, or could that be for a process you're going through? For example, if you're seeing a chiropractor now or whatever, and you're under contract to him or whatnot, would that
More important for a process that you're under now?
Pardon?
The continuity of care
Yeah.
form is
Mhm.
particularly important
Yeah.
for any treatments you are receiving now and
Okay.
expect to continue to receive
Okay, that's important.
September 1st or later, or if,
Mhm.
for example, your surgeon has scheduled you for some kind of surgery after September 1st.
Mhm.
Get that form in sooner rather than later.
Where would we find the form?
As I understand it, I'm
Mhm.
not Aetna. As I understand it, it will be in the materials that Aetna is mailing.
Okay.
We will make a point. We will make a point of asking that a
Mhm.
copy of the form be made available separately so that we can post it somewhere or whatever. We'll
Okay.
follow up on that.
All right. Okay, that's my questions, my two questions.
Thank you. Marcia Clark?
Yes, thank you. I just wanted to clarify one thing with Donna, which I appreciate the John Hancock and the legacy information. And NYSET is also outside of this problem, right? NYSET continues because that's not a PSC city thing.
I don't know the answer to that question because NYSET is, I believe, is related to your union coverage. Unless you're talking, I don't know, the new one.
I have a catastrophic plan through them, I think, a catastrophic medical plan through them.
The only NYSET plans that I'm somewhat familiar with are the two recent ones. And when I say recent, I think they go back about 5 years or more. So you really need to call them to get the definitive answer, because that's outside of the welfare fund, but it's not outside of the city. So I'm not sure.
It's not outside of the city, even though it's a state. Okay.
It could be. I just,
Okay.
I'm not sure. I don't want to give you misinformation.
Yeah, we'll follow up, Marcia, but my understanding is that your NYSET benefits, such as the catastrophic coverage, are not related to, as Donna said, they are not welfare fund benefits, and they are not related to whether or not you're in city-sponsored health insurance. They're a benefit.
I think I have a legal in the financial plan too. So
yeah, they're a benefit of being a PSC member.
Right. So you think, I'm sorry, you think we might retain them?
Yes.
Yep. Even if we opt out.
Yep.
Okay.
And we'll double check with NYSET on that.
Thank you. And Debbie, Belle, I just, you're talking about moving in and out of the plans, opting out or not in November of this year. What happens, suppose I'm in the Advantage plan and 3 years from now, I just can't stand it?
Then November of 2026, you can, say I want to drop out and I want to pick
Go
up
into
traditional
Medicare.
Medicare. Yeah,
And then the problem is, what I understand is that buying the Medigap plan can be more difficult down the road because of age and pre-existing conditions.
it depends on the state.
Okay,
In New York, Medigap plans, let me see. New York Medigap plans can't deny you coverage for a pre-existing condition. The same thing is true, according to my research, which is not
Right.
perfect, in Connecticut and Massachusetts and Maine. But things can change. I mean,
Right.
you know, we are all going to have to keep ourselves up to date on all this stuff.
right.
And
And
I
do
will
you
do my
think,
best to help you.
Okay, I think, Marcia, I think we're gonna go on to the next question, if that's okay, and we can come back or put it in the chat. William Laciza, can't hear you. Can we unmute?
William, try unmuting again. Unmute yourself again. I don't know why.
Okay, it's working.
Oh, yes,
Great.
yes,
All
yes,
right.
yes.
Hey, look, I don't have much, but I just wanted to find out a little bit about these pre-existing conditions. I have a long-term pre-existing conditions, and if I opt in and opt out or try to go back and forth, will that be penalized at a certain point for having the conditions I have?
Depends on the state in which you live and are purchasing a Medigap plan. Generally speaking, in New York now, it's not an issue. You will not be penalized.
Okay, thank you. Audrey Cohn?
Thank you very much. I have 3 questions. I've gone to the Aetna lookup site for physicians several times, and every time I get an error message. I don't get any physician. I see plenty of physicians that are in Aetna's network, but that doesn't mean they accept this particular plan. That's number 1. 2, is there any consideration that the PSC would form a contract with Senior Care, a group contract with all the retirees who choose to opt out, because a group contract would be much less expensive than people buying individual contracts. 3, if you have a Medigap coverage in New York State and I move to California because that's where my daughter is, do I have to get a different Medigap policy, which might have different conditions or benefits? And 4, can one get back into the Medicare Advantage plan sometime in the future if you opt out of Medicare Advantage plan currently? So 4 questions and comments. Thank you very much.
Okay, I will try. I'm trying working backwards, and Audrey, remind me if I've forgotten, if I've missed one.
Okay.
Yes, as far as I know, you can get back in. I mean, as of now, you can get back in, right? 2, if you change states, you will most likely be required to change Medigap plans. I am not crystal perfect on that, but I will check, okay? 3, and I lost the 4th one, but the Medicare, the Aetna website, you should be sure you're looking on the City of New York website, which is Aetna Medicare, all one word, .com/CONY. That's their term for City of New York. And you should not put in the prefix doctor. That's what I discovered. That having been said,
I've done all those things, and
Okay,
still they're
that's
just
good.
error messages.
okay, I guess keep trying. And what was the 4th question?
The 4th question is whether PSC would consider
Oh.
taking out a group supplemental plan so that people who opt out don't each have to pay for an individual plan.
That is, insofar as I have explored that possibility, because I had the same question a while back, that is highly unlikely because of the difficulty involved in, the union is not an insurance company. And you have to be chartered as an insurance company by the state of New York in order to do that.
And Debbie, can we
Thank
just
you.
point out again too that the doctors that accept Medicare, not the Medicare Advantage plan because it's a PPO. So if the doctor accepts Medicare, they can accept the plan. They are not, they don't have to, just as they don't have to accept Medicare at all. So you shouldn't have to be looking for somebody who's taking the plan. You should be looking for someone in your area who takes Medicare and then contacting them to tell them what you have with the information you can get from Aetna and see if they take it. That's what we've been told at every meeting from Aetna, for the members to do that. Otherwise, you're kind of limiting yourself. And then we'll have to go, as Debbie said, from the feedback that we get from the members, whether they are getting in to see the doctors, they aren't getting in to see the doctors, whatever other, if anything else, other issues come up.
Thank you, Donna. Okay.
Thank you.
Patricia Kenyon?
Can you hear me?
Yes, we can.
Okay. Every list of available health insurance plans that I have received from City College of New York, where I work, has not listed anything called senior care. The supplemental that it lists is Empire Medicare Supplemental. Do I assume that when you say senior care, that includes the Empire Senior Care Supplemental? Because there's nothing in any of those lists in the last 20 years that has said senior care.
Good question.
I don't know.
Are you talking about retiree listings of available retiree health plans, Patricia?
Yes.
So probably how it's listed is Emblem.
No, there's nothing listed as Emblem. It's Empire.
I don't have my chart in front of me, unfortunately.
Okay, well, that's a real question for me, because I don't know, you're talking about senior care. I don't know if that applies to me, or this other thing seems to be out in the ether somewhere.
Is our senior care like GHI? I don't want to.
No, it's not GHR. It explicitly says Empire.
Why don't you, Patricia, when you find it or have it in front of you, copy it and let us know exactly what it says.
Or Patricia, put it in the chat. I'm going to review the questions in the chat. So if you can look at the exact name of your provider. Where do you live in the New York City area?
Well, it's not from my provider. It's from the HR department at City College of New York.
Are you covered by Medicare currently?
Yes.
Yes. So you have a supplemental plan.
That one, yes.
Yes. So do me a favor and put in the chat the name of the supplemental plan as far as you know it that you have.
I would have to check that in a file someplace. I can't put it in the chat.
Okay. Where do you live in the New York City area? Do you live in the New York City area? You do live in the New York City area? Or out of state?
Upper New York.
I
live in Suffolk and I work at City College of New York.
Okay, if you can't.
Okay.
If you can't put it in the chat, take a picture of it or do something and send it to us at our retiree at email, PS email, and we will forward it, figure it out. Okay.
Okay, thank you.
Yes.
One
so
thing,
is that, what? Okay, sorry. Is that Donna?
Yes.
Donna.
Just to quickly answer, you can go to OLR, go to the retiree page, and you will see a listing of all of the eligible over 65 retired plans that are available. And I know it's confusing because anybody who would be retiring this month, next month, the month after, will be opting into one of the ones that are available now. And then on the heels of that, if the Aetna Advantage plan goes through, then changing it again. So it can get confusing if if that's why you're asking this question, Patricia.
I'm asking a question to make the connection between what you keep saying about senior care. Does that also apply to this supplemental plan that I supposedly have?
If
And are you-
if you're full-time active and you're working, you shouldn't be in this plan.
I am 70 years old. I officially retired.
Okay.
No,
Okay,
I don't want to-
let's take
We'll,
this.
we'll connect, right? I think we can connect with this.
Yes, we'll get back to you on that, and we should move on because there's a lot of hands.
Yeah, I
Lizette
understand.
Colon.
I understand. I'm just trying to figure out how to get an answer.
Okay, all right. Is Lizette there?
Yes, I am, and good to see you all. So
Okay.
many.
We're losing you, Lizette.
You just muted yourself again. Unmute, try unmuting again. Yes.
Okay, now?
Yeah.
Yes.
Okay, good. I just want to go back to my original question on the chat. Couple of questions. Why aren't we, instead of being told all the information about this Aetna proposed contract, which is incomplete at this point, why can we be talking about the position that our union has taken in terms of the supporting the option C? If we as retirees do not understand what is option C all about, how can we be asked to support it? So I hope that that is the main question that should be answered today is, what does that option C that we are being asked to support, what does it entail? Second, when we are considering opting out, please bear in mind that as union members, we are allowing to create a two-tier system. The people that can opt out, that can afford to opt out from all the unions, including ours, and the ones that cannot. So we are taking two tiers position here when we have never proposed that as part as being a union member. Third, if we keep saying
the time is up, Lizette. Maybe you could raise your hand later.
I'm sorry, because I had the problem with the audio. I have to ask one more question. If we are asking people to go this route, we are going to be supporting the Medicare Advantage plan, which we have said all along that we are against it. So are we now going that route as a union? Thank you.
Okay.
So I'll take that one. Option C is the option that exists in the contract that the MLC voted for. We voted no, but the MLC voted for it. But we found out after the vote that there is an option in the contract that would allow people to retain their traditional Medicare, plus have the city pay for their supplemental Medicare, which is what we've been fighting for all along. That's why we are fighting for option C.
And in terms of the tier, Lizette, this is not a tiered approach because it's not going to cost anybody anything to keep senior care. Everybody can keep their, if option C is chosen, I can opt out of the Medicare Advantage plan. I retain what senior care, the equivalent of senior care, premium free. I don't have to pay $200 or $192, premium free. And then I keep my welfare fund benefits. And that applies to every one of the 250,000 retirees.
What about the actives?
All right, I don't, we can talk about the actives, but that's not right now. Okay, can we make a note, actives who are on Medicare? Is that, no? No, okay.
Active employees are not on, you should, when you hit 65, you should file for Medicare Part A. but active employees who receive health insurance from the city university should not be on regular Medicare.
That's a
Other than
CMS
applying for Part A,
regulation.
which is free.
That's a CMS regulation.
Okay, thank you for clarifying that. Alan Hausman?
Yes, can you hear me?
Yes, we can.
Okay, I am on the Aetna Medicare Advantage plan now. I opted into it 2 years ago. Are they going to take me out of that and put me in a new plan? I know there are several people who are in the same boat I am. And by the way, I also wanted to add, and I think I said this a couple of weeks ago, I was amazed to find out that I also have the Empire secondary insurance paid for by the city. I had no idea. And I don't think any of you did either, because everybody seemed surprised by that.
And Alan, the answer is yes. Those retirees currently enrolled in the Aetna MA plan that's been offered for the last umpteen years will also be automatically enrolled in this Aetna MA plan.
Okay.
Okay, great. All right, let me just remind people, please don't forget to sign up in the chat with your name, with your email, with your phone number. Don't think we have it, because we don't want to go looking through the files. Give us your number, give us your email, tell us that you'll be there and that you'll bring your friend and your other friend and your sister. And if you can phone bank with us, put that in the chat also. Thank you. Vivian Miller. Is Vivian Miller here?
Vivian, try to unmute yourself.
Can you hear me?
Yes, we can.
Okay, now, okay, you might as well see me too. Sorry, I remember in past meetings with you, you had mentioned that once in a lifetime, we can change in and out of Medicare without having to be in the enrollment period. That's a once in a lifetime option. Does that still hold?
Yes.
It holds.
Sorry,
Okay.
that does still hold. Yes, you have the opportunity once in a lifetime to change health plans.
Okay, at any time.
At any time. What I'm not absolutely sure of is how long it takes for the shift to happen under this new arrangement. So I will try to find out. But yes, that still exists. If you haven't used it in the past, you still have access to it.
And
all right, thank you.
There are
Not shit, right? I don't hear so.
I will also add that there are other situations where you can out of sync, if you will, enroll in either Aetna MA or opt out. For example, if you have opted out to be covered by your spouse's health plan, right, and your spouse passes away and you no longer have that coverage, that's what's called a qualifying event, so that you can contact the City of New York Employee Benefits Program and say, I no longer have coverage, and they will enroll you in, they'll enroll you in the MA plan unless you then exercise an option to opt out of it into something else. But so that's the other situation in which the November open enrollment period doesn't apply. And there are some people who are affected by that.
Thank you. Andrea Savage. Hi, Andrea.
Can you hear me?
Yes.
So I'm shocked to hear that the welfare fund is also blocked from us if we opt out. And I'm wondering if there's any other legal routes besides the ones that have already been taken. This seems to me so absolutely unfair to weight the choice so heavily in one direction. So is there any way to sue or block it?
We have taken this up with legal counsel, and this is what we were advised.
Right. So we are presently trying to change the collective bargaining agreement and the welfare fund trust agreement so that folks would not lose their eligibility for welfare fund benefits if they chose to keep their traditional Medicare. So we would not need to sue to do that. We could do it through negotiations with CUNY and the welfare fund. In terms of legal remedies for the city's decision to enter into the contract with Aetna, I know that Steve Cohen, the lawyer for the retirees, is looking at various options. I am not sure what, if anything, he has come up with yet in terms of viable legal strategies.
I just wanted to say one more thing. I am very appreciative of the efforts everyone at the union and have made to keep us informed. My sister is a UFT member, and they have not gotten the same kind of clarity about what's going on. So thank you for all the work.
Yes, yes. And thank you too to everybody who has been following this with us and keeping up with the fight, with the letters, the calls. And now we're going to be out on the street on Friday. So don't forget to put your name and number and email in the chat if you can go. All right. Next person, Stanley Habib.
Hi.
Hi.
You can hear me all right, I hope?
Yes, we can hear you. Good.
Good. I actually am going to ask a question similar to one that I've asked before, but I think I have a better understanding of it now. In the quote, unlikely event that option C is allowed, I shouldn't say that. I really hope it is allowed. But, you know, if option C is allowed and one maintains senior care, there are different parts of senior care. There's the emblem GHI piece, and there is the Empire Blue Cross piece, and then there's the 365-day option. So my question is as follows. Is it assured that if we obtain option C, that we would maintain senior care in its present form, which has those 3 different pieces, of which Empire Blue Cross is strictly provable hospital bill, that the emblem GHI is a personal physician bill? And so those are my questions. That's my question. Can one be assured that if option C is allowed, that all 3 components would be maintained? Thank you very much. And thank you for everything.
Thank you.
The answer is no. Why? Because the city has said senior care will end September 1st. Now, it's possible that if enough pressure is put on the mayor to retain a supplemental plan along with traditional Medicare, that position could change. But as of right now, no, senior care will not exist as of September 1st as an alternate, and the city could choose to retain senior care. The city could choose to contract with another provider to provide a supplemental plan, and then we would have to investigate whether the components that to which retirees are accustomed under senior care, such as your 365-day coverage if you pay a little more, are still there. So that's a big, there are a lot of unknowns.
So let me just. Sure.
Sorry, could I, sorry, Ann, but just be a little lawyerly for a second. Just
yeah, go ahead, lawyerly.
So if you look at the contract, which is very long and complicated, the way it describes option C is in part the ability to opt back into the supplement plan at no cost to the eligible retiree / dependent. Supplement plan is defined elsewhere in the contract as the commercial group health plan offered by the city to its Medicare eligible retirees and their dependents that includes coverage for supplemental benefits that are secondary to original Medicare. So the supplemental plan that's been offered up until now has been what everybody knows as senior care. But there's a number of, commercial health insurance products that offer supplemental Medicare.
Let me just ask a question to see if I can get this straight. A big reason for having a supplemental plan, or what I also call a Medigap plan, is so that when I have a $1 million spine surgery and Medicare only pays 80%, my Medicare supplemental plan pays the other 20%. Okay, so it may not be called senior care, but it will be an analog to senior care, and it will offer us the same advantages as senior care?
Yes. Right,
Yes.
it's the 20%, yes.
Okay, so maybe we need to start to think of something to call it.
We've been calling
after-
it Medicare supplemental plan.
Well, we don't have to do it right now, but after April 1st, if we need to, we may need to rename this and start using a different terminology. Thank you. Tony P. Tony?
There you go. Can you hear me?
Yes, I can hear you.
Thank you for taking my call. Quick question. I am a Medicare eligible CUNY retiree. Regardless of whether or not I choose to take the Aetna plan, what happens to my non-Medicare eligible spouse?
Sorry.
If you're not,
Your
if you,
non-Medicare eligible, your non-Medicare eligible spouse is covered under GHI come September 1st, even if he or she is not covered under GHI now. So all non-Medicare eligible dependents of retirees are going to be shifted to GHI come September 1st. That plan is going to be revamped. That's also effective right now, effective January 1 of 24.
And would that be premium free or as
Yes.
it is now?
Yes.
So I don't have to worry about her as far as medical, but she would not be receiving the welfare fund benefits that we're both enjoying right now.
That is
Debbie?
correct. That is correct. So let me repeat that because that's a very good point.
Debbie, can I just jump in? We were told that the spouse, unless she is eligible for coverage on her own, follows the member. If the member opts out, then the spouse loses her coverage as well, because the member now is no longer eligible and doesn't have an eligible dependent. There is no question. Eligibility is going to go on the member, not on, he can opt out and she can stay in, even though it's a split coverage. They're going to go, her eligibility relies on whether he's eligible or not.
That's correct. I agree.
Okay.
Thank you,
Okay,
Don.
so she would not be covered.
Yeah.
No.
If you opt out of city coverage.
Right. So I would still have my traditional Medicare. She would not, and I'd have to get health insurance benefits for her as well as welfare benefits for the both of us.
Okay, Tony, we can follow up with you on that. Barbara Hanning.
Yes, hi. Am I unmuted?
Yes, you are, Barbara.
Thank you. Okay, so I think this is another side of the questions about spouses that we've been, but it's not clear to me that we've been talking about whether if the member predeceases the spouse is on the member's plan, has otherwise no affiliation with CUNY, but is Medicare eligible. what happens to the spouse?
If a spouse the spouse's eligibility always goes along with the person who has the coverage. So if you are married and your husband is the one who is eligible for coverage, when he dies, you lose
No,
coverage.
yeah. When he dies, I lose coverage.
Right.
Is that what you're saying? Okay.
Right.
That's what I wasn't clear about. It's actually the other way around. I'm the member and my spouse is, so if I predecease him, he loses coverage.
Yes.
Thank you.
But that's not going to happen in the foreseeable future. So,
thank you.
Phyllis Rafty. Phyllis?
Yes, thank you for taking my call. 50 years with CUNY and this happens, it blows my mind. But my question, one of them is, if I have a doctor who is participating and he is telling me I need a procedure or surgery, and he chooses a doctor who is a participant, is that going to have to go through approval if he approves of it?
I don't know if I quite understand. Are you saying he's going
My
to refer
doctor.
you? Your doctor is going to refer you to
Who's a
another doctor for a
For the
treatment?
surgery. Well, he's not a surgeon.
No, that's okay. So
Yeah.
he's going to refer you. So you're going to find out who this doctor is and find out if he will take Medicare.
Mhm.
If he will take Medicare, he should take the case, unless he's not taking Medicare patients. But that choice is
No
up to him.
pre-approval needed by Aetna?
This is where it gets very specific, and this is where
It
Debbie
gets
was saying
sticky, yeah.
we really don't want to. I don't want to give you misinformation, so I would say you should call Aetna. But I believe that whether or not you have that surgery, if your doctor is referring you to a specialist who's going to do it, that they would have to ask for authorization if in fact authorization is required. Your doctor isn't doing the surgery,
so I could
don't know how
deny that.
Now, you could, but hopefully you won't be denied. So,
there'd be just as much chance whether it was the doctor or the referring doctor. But like Ann said, I think that you won't have any problem with these.
okay, let's move along. It's almost 2:30.
I still have something to mention. May I have a few more minutes? I've been living on this laptop, researching everything. The cost of the supplementary programs is absolutely astronomical. I will be in penury in 10 years. It's quite costly. So I just want to alert everybody as to what's out there. And the other thing is, in terms of transparency with Medicare Advantage, I yesterday and the day before read a piece on the journal ProPublica, and they were talking and reporting on what was going on with one of these plans that deals with Cigna.
Okay.
And it's horrific.
Phyllis.
They do not have certified people making decisions. They know nothing about medicine.
Phyllis,
Nothing.
you're absolutely right. And this is a really, goddamn mess. But we have to move on right now.
Okay.
If you have a question later, we can come back.
No,
Joe?
just one more comment.
No.
The mayor never changes his mind. So I think we better be all prepared.
All right, well, we'll be out there on the streets and then we'll go from there. Joel Schwartz.
Yes, hi. Thank you for taking the call. I just want to ask one quick question and then make a comment if I can. The Part B that we talked, that is going to be removed from our whatever we're entitled to. What is the Part B? Is it the welfare fund? Is it the senior care? It's very unclear, and I'd like to have that clarified. And it seems to me we're being forced to be involved in the destruction of Medicare. And we're back to pre-1965. And I don't want to live through that again. I remember working for the city and going after people who were put on welfare. It's not a matter of an individual doctor. Let me say that hospitals I'm now living in Massachusetts. I have for a couple of years now. And the Boston Globe, particularly front page headlines, is filled with information that they will, no hospital, reputable hospital, are accepting Medicare Advantage. It's a con job. It's people who are grifting.
Can you please wrap up, Joe?
Hands on it, and it really is. I think if you have a doctor that actually will take Medicare Advantage, but he sends you because you need surgery, and you want to go to an affiliated hospital where you have to have the surgical procedure done, and they don't take Medicare Advantage, you're finished, and that extends really through.
Joel, thank you. And I think we all appreciate your anger and the anxiety. And I think that's got to continue to be our message, within our message, that this Aetna company is under investigation and has all kinds of problematic issues. And the mayor shouldn't even touch it. But that's my speech.
To answer your question about Medicare Part B, when you retire and are no longer receiving health benefits through CUNY, you should have enrolled, and I assume
Don't wait.
in Medicare Part B, and you make a monthly payment. It is deducted from your Social Security check, so you don't really see it. If you look at the letter you receive once a year from Social Security explaining how much you'll see there's a Medicare Part B amount. It is standard. I think it's $137 a month.
$165, Debbie.
165. Anyway, so it's worth about $2,000 a year, and the city reimburses that amount on an annual basis during April of the subsequent year.
Okay, thank you, Debbie.
But Debbie, one other thing I just wanted to explain too, on Medicare Part B, that's traditional Medicare of $100 office visit. Medicare Part B will pay 80%, so they pay $80. The supplemental, on the other hand, is what would pick up the remaining $20. I wasn't sure if that was your question or exactly how the Medicare Part B was charged.
Okay, thank you, Debbie and Donna. Michael Miller. Can we unmute Michael? Michael, unmute yourself.
Michael, try again. Yeah, hit unmute again. We still can't hear you.
Not.
Okay, now we hear you. Oh, do it again.
Still can't hear you.
Okay.
Yes,
Okay.
yes.
Okay, thanks. We live out in Oregon, and so I went through the list of Aetna Advantage hospitals and doctors, and I was able to find all my doctors except one that were taking Aetna, but it may not be this particular program. Actually, this one is probably better than the others. And the hospitals too, all but one hospital here, except. So I think it depends on the state. Massachusetts may be different. But my question is two of them, really. One is that you said that if we did accept the Aetna program, we should not take the rider, the drug rider, correct?
Correct.
Okay. But they also give a hearing
I think $500. And now we have, through the welfare plan here, a very good hearing plan. Do I have to opt out of that hearing as well?
No,
Aetna?
no, you bring up a very good point that I missed. Both your hearing and visions can supplement the benefits that the welfare fund gives you. So you can use the welfare fund's hearing benefit. And if you have any out-of-pocket expense, you can then put that through to the Aetna Advantage plan. For the vision, I would think you can do the same thing if it's, I'm not sure of the vision coverage, how it works. I know the hearing is $500 every year. So when you go to get your hearing benefit from the fund, if you opt into one of the top tier hearing aids, there may be some out-of-pocket cost.
Yes, there were.
You might have exceeded what the benefit amount is. That you can put in to get back from Aetna.
Oh, really? Oh, that's very good.
Okay,
Well,
I think,
are there vision provisions in Aetna?
Yes, there are. You should also be able to use them. That's what Aetna is telling us in combination with the welfare fund. So you can get a pair of glasses from the welfare fund and go to Aetna.
Great. My final question is this. I read recently that there are many of the Medicare Advantage plans that are now using an artificial intelligence tool to decide how long people should be in hospital or getting nursing care. And they were actually cutting people off way before what the doctors thought was necessary. And there was a lot of, fighting back and forth. In one case, it took so long that the woman who was trying to get the money died.
all right,
Aetna
thank you,
is one of
Michael. I
those.
know there are a lot of
Aetna
horror,
is- I'm sorry, Aetna
there are a
is
lot of
one
horror
those plans.
stories and a lot of good reasons to be Aetna shy, but we got to move on for the rest of the questions.
Okay,
Thank you very much. Susan Wartzman.
you're welcome. Right.
Hi, can you hear me?
Yes.
Thank you. Here's my comment. I'm finding the same dilemma that I had 2 years ago when we went through with the Alliance. When I call up my doctors, they say they cannot tell me anything if they're participating until they have the specifics of the plan. So just going on to the Aetna Medicare Advantage website and looking them up is not valid, because I'm sorry, I do not believe that in 2 weeks, Aetna has managed to inform every physician and hospital, in the metropolitan area about the plan. So I spoke to someone, just a point of information. I see many doctors in a medical group, and I spoke to their billing financial counselor today, and they said, we can't tell you anything until you have your benefit card and you can tell us what the code is. So it's like chicken, chicken or egg. It's like, I can't make a decision about opting out, if I won't know until I'm opting in that, they're accepting it. So that's the big dilemma.
And it's really frustrating and enraging. And I Debbie smiling, I mean, we will do what we can do, but you're absolutely right. Valerie Krishna. Valerie Krishna.
Can you hear me? I've just unmuted. Yes.
I can hear you, yes.
We've talked a lot about the Aetna plan, which is the main plan. We haven't spoken about the alternative, the HIP VIP. Where is the information about that? Is anybody talking about opting into that? Will it be in the packet that goes out, or will that packet be only from Aetna? Where can I get information about that?
You can, the HIP VIP plan is a Medicare Advantage HMO. You can go onto the OLR Employee Benefits Program website on the retiree page, and you can scroll. They do have summaries. They have plan summaries, and you can look for HIP VIP because it exists now and get information about the plan. Most likely you will have to call the plan itself with your questions. As I recall, when I looked at it a couple of years ago, it wasn't terribly informative. The distinction is that as an HMO, they have a set of doctors, and you go to those doctors, or if you don't want to go to those doctors, you are not covered.
Okay, sounds bad. Thanks.
Well,
For the
it works for people. It works for people who live in the New York City metropolitan area who've used the HIP plan as active employees and have made that work. So that's really who is in it as retirees.
Okay, I think it's out of bounds for me, but thank you.
Thank you. George Bletcher.
Hi, can you hear me?
Yes.
Two questions. One is if the mayor doesn't choose option C and we opt out, what is the cost and the process of getting supplemental insurance? How do you go about that, and what is the general cost of that? Also, if he does choose option C, does that mean that we find a supplemental plan and then somehow the city covers it? Question one. Question two is about drug benefits.
Can I stop you and deal with question one first?
Sure.
If option C is implemented, it would be because the city chose an insurance company to provide a Medicare supplemental plan.
I see.
Okay, and was willing to pay for it. The reason I put the Medicare Rights Center information in the chat is that they are the people you should go to find out what plans are available, what Medigap plans are available where you live and the prices associated with them. Someone I saw put in the chat that the AARP Medigap plan, or I don't know, I think there's several, but one of them is about $325 a month.
Okay, and that is if we opt out.
That is if you opt out.
I see. Okay. Second question is about drug benefits. If we opt out, do we get drug benefits from somewhere? If we stay with Aetna, do we get the union drug benefits or some other drug benefits through Aetna?
If you opt out, you're not eligible for welfare fund benefits. If you opt in, you're eligible for the benefits that you have right now, the Silver Script, welfare fund, Medicare Part D coverage.
So there's
Same that
no
you have
coverage.
now.
So there's actually no coverage for drug benefits if we opt out.
No coverage for drug, dental, hearing, vision, no coverage for any welfare fund benefit.
But no coverage at all. In other words, we would have to, I mean, we would pay.
Supplemental plan. You'd have to get a supplemental plan, but we are fighting. We are fighting to keep those Medicare, those welfare fund benefits, and we are fighting, and we are fighting for that.
Right.
Thank you, George. Barbara Backer. Can you unmute yourself, Barbara?
Diane, do you unmute Barbara?
Okay, can you hear me?
Yes, yes,
Okay,
good.
Yeah, okay. Yeah, thanks to all of you for this tremendous work you're doing on this. I share my colleagues' anger at this whole mess, quite frankly. I think it's appalling in a way that the city presents us with literally no choice, because we're penalized if we opt out, and if we don't want the medical advantage, we're also penalized. So my anger knows no bounds on this. I am a registered professional nurse, and I know from experience and personal experience that patients are sent home greatly in need of care because their insurance does not cover them. My question is basically, if we opt out and choose Emblem as a Medigap process or gap insurance, that is not considered anymore under the city. So we're totally out on our own if we choose Emblem. Okay, thank you.
Yes, you have to use one of their programs, which right now is just Aetna or HipBip.
Okay, thanks.
Thank you. Vivian Miller? Vivian, you need,
Yeah, I'm here. Can you hear me?
yes.
Okay. I was just curious if you have an emergency and you end up in the hospital, an ambulance takes you, are all the hospitals going to be covering that emergency?
We were told by Aetna that they would be as if anything that was covered as an emergency that they would be covering, but there are a list of hospitals that do take the Medicare plans. They should all be in the network, but that's what we have been told. And if anything were to happen, emergency like that, first thing you should do is call Aetna right away and let them know that you are in a particular hospital. But that's all I can tell you that we've been told.
All right. Thank you so much.
Okay, before I call on Nancy Oley, I'd like to ask Nancy if she would like to make her announcement again, because she's got to leave for another meeting to help plan the Friday action. So Nancy, go for it.
Sure. So please put your name and your phone number and email in the chat if you can join us on Friday, this Friday, March 31st at noon at City Hall. And if you can't make that, that's okay. Help us make phone calls to increase the outreach. It's really important that we reach out to as many people as possible and let the mayor know that we're serious and we're not going away. So all the work that the staff and the leadership of the union has done so far, and as you see, it's been enormous trying to figure this out. And note that we are the only union of the, 104 in the city that's actually done this. Please help us to do the kind of outreach that we deserve. Thanks.
Right. Thank you, Nancy. Thank you very much. Nancy Oley? Nancy Oley? Hi, Nancy. You have to unmute.
Okay, thanks. I have a question. If we opt out, let's say on May 1st, is that a qualifying event from in terms of getting another Medigap plan? That's the first part. And the second part is on September 1st, when, let's say we've opted out, will we get some sort of paperwork from Emblem Health certifying that we no longer have coverage that we can use to go to another company?
Those are good questions, and I'm not sure I have solid answers for those. However, if you opt out, that is not a qualifying event for the purpose of Medigap. You just have to go out in the market and buy a Medigap plan. I would encourage you not to opt out May 1st. You don't have to. You have 2 months. I don't know what Senior Care will send you about their coverage ending. We will try to find that out.
Thank you.
Thank you.
One of the reasons not to opt out right away, but to wait till closer to the deadline is, as folks will recall on the last round, the lawsuit occurred during the opt-out period. So it's just, I think, makes sense to wait till closer to the end of the period so you have a better sense of what's actually going to be happening before you make your decision.
Thank you.
Right. Thank you very much. Marlene Gottlieb?
Yes, hi. Can you hear me?
Yes.
Okay. If I have a very specific question. If I take the Medicare Advantage, can I then also, excuse me, sorry, this is crazy thing. If I take the Medicare Advantage, do I also keep my dental from the welfare trustees? If I take it,
Oh, I'm sorry. Yes, if you take it, you keep everything. Everything stays status quo.
Okay, very good. Thank you. That's my only question.
You're welcome.
Okay, great. Alan Schwartz?
Yes, I'm calling from Florida. I just got off the phone with an Aetna representative to schedule one of those in-person meetings. And I said to him, the doctors that I saw on the list that don't take Aetna do so for a reason. Did Aetna send out anything new to these doctors to let them know that there's another option now, that if they accept Medicare, Aetna will pay them the Medicare amount? And the answer was no. So I'm asking, is there something that we can get in writing that we can present to a doctor that we may use that doesn't take Aetna, that does take Medicare, advising him that this is another option for you without having to join Aetna? And that's something we can take to any doctor and give it to him, rather than just to say, oh, by the way, I know you don't take Aetna, but you can get the Medicare amount. Am I
as we understand it, and Donna, you can correct me if I'm wrong. Number one, you can tell the Aetna representative that you talk to, you can give that person the names of your doctors and say, call them up, talk to them. And B, there are materials, I think they're actually on the Aetna website, that are aimed at providers. And Aetna has said they are encouraging patients to take those materials to their providers about this plan. And I think that material was on the website. And if it's not, we will tell them it should be.
Right, definitely
Yes.
should be.
I can get that, but I specifically asked that question because I spoke to Aetna during the week, and you're supposed to be getting these 2 huge mailings, which is probably going to just confuse everybody even more. But in that mailing, there's a packet that should explain what you can do and give you information to take to your doctor's office with phone numbers.
Right. One more thing I'd like to add. Hello?
Yes, we have you. We hear you.
Okay. At the last minute, at ground zero, when we have to sign that form or whatever comes to us, will there be a resource that we can contact just to make sure we didn't check the wrong drug box or something and opt out of our drug plan if we're going to stay in? Will there be someone that we can call? In other words, at the last minute, if we have a question.
You should not have any problem with that, because Aetna is aware that any of the CUNY retirees should not be allowed. You should not be allowed to opt into it. So even if you check the wrong box, they're supposed to have a control that will not allow you to opt into it. And if somebody is to do that, they should be sending us some type of message, but you shouldn't have to worry about that.
Great, thank you very much.
Cynthia Haller?
Hi, thanks for calling on me. I wanted to ask if we're in HIP VIP Prime, which we are currently. It says something about needing to specially elect the Aetna plan, because we are more interested in a PPO than an HMO. So is there some form on I couldn't find it on OLR, but should we decide we want to go with Aetna, what's the process for getting to Aetna?
I'm going to have to check with OLR or Aetna to find out, because you're right, everyone else will be getting that opt-in notice.
Right.
I'm not sure if you will be getting that notice. So you know what, Cynthia, that's a good question to take back.
Yeah, because I definitely would want to switch to the PPO. Thank you.
The contract says that people will be defaulted into the Aetna Medicare Advantage plan unless they opt out.
No, then the website is incorrect, because the OLR website says we have to select it, because they're going to continue HIP VIP Prime. So I guess they would assume that we want to stay in that unless we indicate otherwise.
No, you'll have to opt out to get into, if you want to get into the HIP VIP plan.
Okay, but can you
No.
just
Well,
double,
we'll follow
No.
up.
yeah, please double check, because we just want to be sure we don't miss the.
That's not the way, that's not what OLR is doing. So
Alan-
we'll double check. Cynthia, we will double check. I mean,
Thank you so
Alan-
much.
Alan Houseman, did I call on you earlier? Did I call on you earlier?
Yes, you did.
Okay.
I had
so-
another,
so
I
I'm-
had another comment. That's all.
Okay, I'm just gonna go back and then I'm gonna call on Lizette and you for a second time. But there's somebody bothering me here at the computer who has a question and he wants to ask it. Alan Friedman.
Yes, I looked up what a PPO does, and if somebody is not in the PPO, the preferred provider organization, the doctor is not in the PPO, you have to pay up front and then ask for reimbursement from the PPO. Am I correct on that?
It's, yes. You know, yes.
Yes.
The thing about Aetna, and this is where it gets tricky, and this is why we criticize Medicare Advantage and their networks. For providers who are in network, Aetna makes it easy. There's a form they fill out, they send it in, they get paid. For providers who are not in the Aetna network, but do accept Medicare, in the one sentence version, they reimburse the Medicare rate to that provider. When you look at the fine print, Aetna suggests that provider, in essence, get a prior authorization that the service they're providing is medically necessary. They do not require that provider to just even if it's medically necessary, to just submit the bill and get paid. That provider could charge you up front and you would have to submit for reimbursement from Aetna. But the fine print issue is a predetermination that whatever service that doctor is providing, even though he or she takes Medicare, is been deemed medically necessary by Aetna. So they make it non-network providers who accept Medicare accessible, but they throw in some wrinkles.
And it could take months to get your reimbursement.
Or years.
I mean, if it's been deemed medically necessary, it could take weeks.
Okay.
You know, okay.
Okay, Jeffrey Siegel.
Just a clarification. I'm a retiree, of course. If I was to predecease my wife, does she still have coverage? I wasn't clear about that in terms of, was she cut off, or what happens to the spouse that was not a member?
The spouse that is not a member loses coverage. On the retiree who has the coverage, on their death, any dependents or spouses will lose their coverage.
Is it right away? Do they lose the coverage right away, or do they have a grace period? How does that work?
Up to the end of the month, and they can also COBRA their benefits.
Oh, okay. Say that again. They can also what?
COBRA. Pay
Okay, pay COBRA.
Okay.
So they just would call up. You just would call up the office and
The
tell
Office of
them.
Labor Relations and the Welfare Fund, if you want to continue the Welfare Fund benefits.
Okay, got it. Thank you.
Thank you.
Okay, Janet Speckman.
Yes, I have to opt out because every single one of my doctors absolutely refuses to have anything to do with Aetna, and I'm looking at surgery. Why, if we have to opt out, do we have to have the TIAA annuity?
You know, there is a, it's a logical question. If you have to opt out and you expect you will never opt in again, why do you need the annuity? Why do you need to have a pension? Probably you don't. However, one, you never know what's going to happen 2, 3, 4 years down the road in terms of wanting to come back into city coverage, a completely different kind of city coverage, conceivably. 2, the likelihood of the PSC being able to negotiate little variations based on some retirees having no interest in city health coverage, I believe, and this is my judgment, I believe is minuscule. This was an agreement that was reached decades ago to permit the city university to establish the optional retirement program of retirement plans. And it was a kind of compromise. And I suspect that CUNY is not gonna be willing to pick and choose, if you will. I'm just being honest. You know, that doesn't mean we won't raise it. It doesn't mean that it's not a logical question, but just to be honest.
Thank you.
Bonnie Nelson.
I just want to point out that the $10,000 that you annuitate.
We lost you.
Just like to point out that the $10,000 you annuitized in order to have the equivalent of a city pension is gone. It's gone into an annuity, and you are getting the benefit of that every month. You're getting an amount in your bank account every month from that very small annuity. The question about the other $40,000 that they're requiring you to keep in reserve, that's something else. But anything you have already annuitized is gone. You can't get that $10,000 back. You are getting the benefit of the annuity.
But the remaining $10,000, whatever remains after these monthly payments, will go to your estate. It's not gone forever. I mean, it's not gone from.
Am I right there?
Gotcha.
Okay, well, it's 3 o'clock. Lizette, is that an old hand or a new hand?
It's always a new hand.
It's always a new hand.
A new
Okay.
hand, any question.
This is your last
Question.
hand for
After-
today.
Yes. So after Friday's rally, which I'm so happy that we're going for it. After the rally, what is the plan to fight back this awful Aetna option C, if it goes or not? Whatever it is, we want what we had before. We want to have the welfare fund, the money there. So can you please make sure that in the next meeting on the 4th, we can have, you can present us the plan that you have as the PSC retiree chapter leaders to fight back, because it's not going to happen. Sadly, I am very negative about the mayor. So if it doesn't happen, what are we going to do? And if we're going to join the litigation of the New York City's Organization for Public Service Retirees. So looking forward to the next meeting. Thank you.
Okay, I'll see John Magel and then let's close. John? Oh, and then another hand.
Can you
John
hear me?
Magel?
Can you hear me?
Yes.
Yes, just 2 quick questions. I had previously opted out of the previous program they offered us last year, and I got an official letter. I'm assuming that will be nullified, number one, and not applied to this at all. And the second is, I noticed that Stony Brook University Hospital on Nichols Road in Stony Brook, their main hospital, was not included in Aetna. And it seems odd because all of the Long Island hospitals are.
One, if you opted out 1.5 years ago, that is null and void.
Thank you.
If you opt out this time, you opt out to Aetna, not to the city.
Okay.
And 2, Stony Brook is not in the network, as I understand it. This is from 3 weeks ago. Stony Brook is not in the network. However, they accept Medicare And Aetna says it has a relationship with Stony Brook such that it pays for care there. Again, Aetna says.
Right, so it's really indeterminable right now.
Okay.
Not fully. Thank you very
Diane,
much.
thank you. Diane Ducat?
Thank you. I have Empire Blue Cross Blue Shield, not Senior Care. Will that be available once this, as you know, if I stay in Medicare, will that plan be available for me for my supplemental?
None of the only two plans that will be available will be the Medicare Advantage plan and the HIP-VIP HMO plan.
Okay, thank you.
Okay, well, thank you so much to all of you for your really important questions and comments. And of course, thanks so much to Dean and Debbie and Donna. These are not the only people working on this. They're the people in front of you today. There's a lot of work going on back at the PSC amongst the elected leaders, our legislative operation, your retiree executive council has met, I can't tell you how many times this week. We have subcommittees. And in answer to what Lizette raised, we do have to have a strategy beyond April 1st. And for now, for this week, if you haven't sent a letter, an act now letter, or called the mayor's office, please do that between now and Friday. This morning, I heard that about 1,500 letters had been sent. And some of those letters have been sent to two or three people.
It's way more than that now. It's
What is it now?
It's up close. Right before the meeting started, it was around 3,700.
Okay, well, that's not enough. Okay, 3,700. Let's get to 50,000. This is a letter that is going to be sent not just by us retirees, but every single in-person PSC member, other union members. We've got to jam the mayor with these letters and phone calls. And then it's great to see a lot of you, I don't know how many, but a lot of people did sign up, I think, to say that they were ready to come out on Friday. And that is great. And people ready to make phone calls to get other people out. So this, oh, I see a couple more hands. Okay, I'm gonna call on the, no more hands? Somebody shaking me, no more hands. Can we hold these till next week? We're going to have a meeting.
What exquisite and extraordinary flower.
Okay, we're gonna have to close this meeting because some of our people have to go to other meetings and other stuff, but we have a meeting next week, a regular chapter meeting. Please sign up. And the second part of the meeting will continue this discussion on the Medicare crisis. And we will continue to fight and develop strategies. And we have a few months to do that, and we will. And this is a fighting union, and we're very lucky to have the PSC behind us, because the leadership of this union does not only have to deal with our issues. There are 30,000 people in the PSC, and they're fighting for a contract, they're fighting for budget. There's many things, but this has been front and center for the PSC leadership. James has stood up very courageously in the MLC, taking the right position, and we are not giving up. So thank you to all of you. And I will see you on the line on Friday. And if not, then on Zoom on Monday. And I'd love to play that video again, but can we cue that up? I think maybe that our queuer upper is maybe falling asleep. So, all right, guys, great job. Wonderful. Enjoy the day.